Through Putting You First, Scottish Care Associate Dr Sue Newbury has been working to enhance engagement and involvement with the independent care sector across the region. The role has included exchanging knowledge and best evidence-based practice amongst partners, as well as identifying opportunities for development.
I think what Putting You First are doing is literally putting the older person and the carer at the heart of what they do. And for us, that means being one of the partners that, for example, if we take an outcomes-focused approach to supporting an older person and their carer, it's about all of us, NHS, social services, care providers, independent and voluntary sectors, all of us working to our own strengths to help that older person achieve what they want and need.
Putting You First funding has enabled the Dumfries and Galloway Hard of Hearing Group to develop more drop-ins across the region. NHS hearing aid maintenance is offered, as well as support in managing hearing loss from trained volunteers. 3,228 visits were made to drop-ins in 2013.
There is approximately about 25,000 people in Dumfries and Galloway with some level of hearing loss. And prior to our service, they would have to go to audiology just to get basic maintenance. And maintenance is quite a lot of maintenance with a hearing aid. Probably every 3 or 4 months you need to get your hearing aid maintained. And for some people, a trip to Annan or a trip to Dumfries, it's quite a stretch for them. 40% of our service users are over 80, so quite a lot of them aren't driving anymore. Don't have perhaps the networks to be able to get them to the hospital, and it's just to go for a sort of 10-15 minute appointment seems a real waste of time for them.
Putting You First enabled the Integrated Community Equipment Service to expand a new scheme where drivers can now fit a range of equipment in patients' homes. This makes for a less intrusive and faster service and saves around 52 hours per week for occupational therapy staff who carried out installations previously.
Well, we started planning last year quite a number of projects, started having meetings and discussions with quite a wide range of people from health but also from third sector organisations as well, and one of those was looking at how we could develop the community equipment service further, and that we could go through a tester change with having driver fitters from the community equipment service to actually go out and deliver and fit the equipment.
Putting You First project was certainly an opportunity for us to take on board and try new projects which we've been looking to do for a number of years. This service has developed. I've been working with this service for more than 10 years, and we have progressed and done lots of new changes. But the opportunity that Putting You First gave us was the ability to enhance patient delivery service, enhance our service, and provide a greater range and a swifter response to the needs of the requisitioners and of the patients.
The Dumfries Hub is a multi-agency pathfinder, representing a new approach to ensuring people get the right support at the right time from the right services. The project co-locates staff with a wide range of expertise, all working with adults registered at the Greyfriars and Charlotte medical practices. The Hub introduces a new role, the third sector single point of contact.
I thought it was a really good idea. I mean, I think that we all understand that there's very limited resources, and we have to do something different in order to provide care to people, particularly older people, because the demographics are such that the older population is going to be absolutely huge, and we need to find ways of providing appropriate support to them.
It certainly makes life a lot easier, whereas before you'd pick up the phone and try and get a referral, and it would take maybe a day or two, or the person would be off, or someone else would phone you back. Whereas in here, we have daily meetings, and also if you need to speak to someone, then you can just go and see them, as opposed to sitting on the end of the phone.
For the whole health and social care hub, actually being the opportunity to be co-located together in a building was something that's never been done in Dumfries. So to do that was really, really good. But also at the same time, there was this period of, well, we didn't know what it was going to look like. We didn't know who the people were that we were going to be coming to work with. And there was all that sort of, we kind of know about them, but we don't really know about them. So coming into the building gave us the opportunity to actually see people face to face and do that.
It's really given us an opportunity to understand each other's roles and the pressures that are placed upon us. And also, really, I think the valuable thing is that we now work together more seamlessly to provide a holistic approach to services, etc. So that's been really beneficial.
It's very much patient-centred, and the outcome is for the patient, not just what we think might be good for the patient, but then we can actually take it to the various departments to make sure the outcome is for the patient.
We have a meeting every morning where we bring sort of people in and have, not actually literally, but we bring people in terms of discussions, and it offers the opportunity to see who's best placed to go out and do the visit, and it's not only avoiding duplication, but it's ensuring that people see the right person at the right time.
My role is mainly more overseeing and sort of working on doing the plan, do, study, act, the sort of test the change methodology. And again, if it hadn't been for the Putting You First in the programme and bringing all the sort of teams together beforehand, we had loads of workshops before we actually got here, so we had the opportunity to sort of get to know some people. So when you were coming to the building, then they were more like kind faces, and therefore it was easier to go and approach people to say, what do you think about this? Would this be a good idea? Could we do that as well? So that was really, really good.
As far as I'm aware, the majority of patients seem very happy with it. Things are getting done a lot quicker, they are getting done a lot quicker. There's a lot less red tape to get through, so it's certainly beneficial for the patient.
Alzheimer's Scotland received funding through Putting You First to develop projects helping with self-management, peer support and coping strategies. Support also funded an organiser to expand a range of specialist-friendly activities based on people's interests and hobbies in their local community.
The post that I fulfil allows me to provide activities that are person-centred. People with a diagnosis in the early stages can still carry on an ordinary life. So to be able to be a part of that and help and support individuals to still access things that they enjoy doing but maybe don't have the confidence to do, I think is making a huge difference for a huge number of people. And to be able to be a part of that is just wonderful. It really is fantastic.
Putting You First funded projects in the Annan Area which looked at respite care, trips and falls and also forward-looking care. Focusing on care homes in the Annan Area, these pilot projects were designed to emphasise a person-centred approach to care options.
Really excited because we've been doing a lot of work with respite care and the benefits of allowing people to come into a care home setting just to get a feel for it, to get to know the home, but also know they could still go home as well. And it was changing the community's perception of what a care home was and what we can actually offer. So the opportunity to keep poorlier people in their community area without going to the hospital was really a positive step forward for us, and was really keen to be involved with that.
So people are given the opportunity to be cared for locally, either in a care home setting or within Annan Hospital, rather than go to DGRI. The benefit to that is that they're still receiving nursing input, they're receiving their GP visits. It's just making use of local services in their local community and also allowing family members to visit more frequently too. It's been a very big success. We've had 4 phases of it. Initially we started with just Annan Court for a 6-week period. We then did Annan Hospital for the same amount of time. Our 3rd phase was Annan Court, Lydia Field and Annan Hospital, and latterly we've just finished phase 4 where we included Notwin in that phase. So over the 4 phases we've had 16 admissions that would have gone to DGRI with very positive feedback from the patients themselves and family members. And we're just currently looking at phase 5 and extending it to the wider community and possibly out with Annan as well.
The award-winning Ideas team supports care homes in Dumfries and Galloway to improve the quality of life of people with dementia. This multidisciplinary team is made up of staff from nursing, occupational therapy and clinical psychology who take a holistic approach in developing staff knowledge and skills in dementia and exist because of Putting You First funding.
In terms of the occupational therapy specifically with the bid, we've really been trying to focus on looking at the current care home environments and looking at what kind of level of meaningful activity people are doing, as well as with the core staff delivering basic training on dementia and general knowledge training on dementia to try and enhance care home workers' staff and roles.
I had never heard of PYF until I came back to the trust to work, and this opportunity came up, so it's a great opportunity to do something different, I think. So my role within the team is looking at physical health, getting the care home staff to recognise physical health issues, address that quickly so that it doesn't actually escalate into stressful behaviour for the patient. I think it's a fantastic idea to have a separate ring-fence body of money that can give people like us the opportunity to try something different. Unfortunately, we don't have that opportunity a lot in health to change things, and it's usually small pilot projects that we can never sustain. This has given us the opportunity to do something on a wider scale that we can hopefully sustain for future. I think we've all learned from each other. Each skill set is different, and I think we've all learned a lot from each other. I think we've also, if you look at the wider integration, we've linked with primary care, we've linked with Alzheimer's Scotland, we've linked with social services. So I think, that's been an opportunity that we might not have had if we hadn't had the funding, to go a bit wider, really.
The DG Direct Council call centre in Dumfries has been involved in a number of Putting You First projects which have helped older people living in their own homes. Initiatives around falls, remote monitoring of vulnerable people and telecare self-referral have all shown considerable potential.
The falls single point of contact, as it's called, where the ambulance service would attend at client's home, perhaps fallen over and establish whether or not they needed to go to hospital. For those that didn't go, my team would take all the data, pass it on to the relevant doctors' surgeries, and just make sure the clients were well in their own homes over the weekend while there was no GPs. We would have had very little involvement with the Scottish Ambulance Service before that. So yeah, it certainly has provided a lot more collaborative working. The person benefiting the most will be the client in their own home. They have the reassurance there that someone's going to contact them and make sure that they're well through the weekend, as well as knowing that their details are going to get to their GP on the Monday morning. We have a team of staff based in the contact centre, as well as a couple of remote workers who go out and install the equipment. Our guys go out and install various pieces of kit, thermometers and other such appliances in their home. The client in their house will give readings every day, whether it be through the thermometer, and the readings will come through to my team in the contact centre. They have a guideline on colour coding. If it's green, everything's okay. If it's amber, they have certain guidelines to follow. And again, all that is fed back through to the client's GP. There's the telecare referral process, which was initially set up in the Estill Muir and Langham areas of the region. All clients over 75 received a letter through the post inviting them to refer themselves almost for telecare. Anybody that said they wanted it received a visit from our technician who went out, assessed their needs and installed equipment if necessary. And since then it's been rolled on to the Moffat area, which has proven very successful. Things are evolving all the time. From when the care call started about 20 years ago, it was simply a box on the wall that was massive with a pendant round the neck. It's so advanced now that you don't even need to press buttons. If you fall over, the detector will automatically send a signal through. And ultimately it's about keeping people safe in their own homes. It's all about giving the clients the opportunity to make that decision for themselves, regardless of what projects we've been involved in. Excellent piece of work by the PYF team.